And welcome back. Let's get into the endocrine system by special request. So the endocrine system includes the organs and the hormones it secretes. So most of the glands, so hormones are chemicals that kind of regulate the functions of the body, organs, tissue, and other cells. So they'll produce their product that goes to the target tissue. So endo means within. So here the hormones will be circulated within the bloodstream. And this is to oppose exocrine glands. Those are like your sweat glands and your digestive enzymes. They don't go into the bloodstream. They just enter or go to the target tissue via a duct. So endocrine enters the blood, so they're ductless. And we have a couple types of hormones depending on its function. First type are going to be your steroid-based hormones. For example, estrogen, testosterone, vitamin D. They can cross the cell membrane. As you recall from fundamentals of anatomy, the cell membrane is made out of lipids, and there's going to be water on the outside of the cell and water on the inside. So steroid hormones, they can actually wiggle their way through the cell membrane. And since the nucleus also has a membrane, the steroid-based hormone can then enter the nucleus and directly affect gene expression. So here's an example of a steroid hormone. So from within the bloodstream, it can make its way through the cell membrane and into the nucleus of the cell and directly affect which genes are turned on, which are transcribed, and then ultimately translated. Non-steroid hormones, these are mostly protein-based, and protein-based hormones are hydrophilic, so they're going to act like water. So the same cell membrane is made out of lipids. This time the protein cannot penetrate the cell membrane. So we'll need to somehow get the signal into the cell. So this is accomplished by the G protein complex. So all it is messengers. One group of proteins sending the message to the next group of proteins. So here we have a diagram of a protein hormone. So it cannot penetrate the cell membrane, so it'll activate a transmembrane protein or interact with a transmembrane protein. And this is like ringing the doorbell on the outside, and that message is carried along to the next messenger. So here's the G protein, needs a little bit of energy, and then it goes to the next messenger, needs a little bit of energy, and then ultimately, once all the messages are relayed, it targets and regulates the specific cell activity. Not exocrine, not endocrine, but paracrine. So prostaglandins are called tissue hormones, and that's because they just work close by. They're not excreted through a duct, they're not entered into the bloodstream, they're just local. So when you have, let's say, an injury to a certain area of the body, you only want the injury response to stay at that area. So for example, if you bump your knee, then you only want your knee to be swollen, blood flow, and immune cells to enter the knee, not the whole body or anywhere to the outside of the body. Hormone self-regulation. So we have two types of feedback loop: negative feedback loop and positive feedback loop. Let's get into the negative feedback loop. So the example used here is blood sugar. So when you eat a meal, your blood sugar will increase. That is detected by your body, and your pancreas will secrete insulin. Insulin will work in the liver and the muscle tissues of your body, taking up the sugar and lowering the blood sugar. So that is redetected by your body. Blood sugar is normalized and it stops. The pancreas no longer produces insulin because blood sugar has lowered. This is just another diagram explaining the same phenomena in a negative feedback loop. You eat, blood sugar goes up. The effect is insulin release. The liver takes in the sugar. Your cells, your muscles take in the sugar. Blood sugar goes down, and then it's redetected that it's normal, and then the pancreas insulin secretion is shut down. So there's a negative feedback loop. The result will stop it. Whereas in a positive feedback loop, there will be stimuli, or there will be a result as long as there's stimuli. So here in the example of breastfeeding, as long as the mother hears the baby cry, or if they're suckling, then that will produce the hormone oxytocin. Same hormone that causes uterine contraction and also a bonding hormone. Its release causes milk to be released, and milk will continue to release as long as they're suckling. So it doesn't end. It doesn't turn itself off as long as there's stimuli. Quick overview of the glands in the body. So at the base of your brain, you got the pineal. Below the hypothalamus, you have the pituitary. In your throat, you have the thyroid. And embedded in the thyroid gland, are usually 4 nodules of the parathyroid hormone. Right above your heart, you have your thymus. Your adrenals, they are added to the renals, so they're added to your kidneys. They sit right above your kidneys, and they have different parts, cortex and medulla. Then the pancreas, it has both exo for digestion and endocrine function for hormones. We mentioned insulin. We'll talk about glucagon shortly. And then the male and female glands, ovaries and testes. All right, let's begin with the hypothalamus. So we have the thalamus, and right below it, the hypothalamus. So the hypothalamus is the bridge between the nervous system and the endocrine system. It produces 2 main hormones, oxytocin and antidiuretic hormone. However, it is then stored in the posterior pituitary. So this is where it's stored and ultimately released. So this might be a common question. Where is oxytocin made? And then which gland releases it? So this is more of the neural component, the posterior pituitary. So they'll call this the neurohypothesis. The pituitary gland. So here we have the hypothalamus, the posterior pituitary, and then the anterior. So the anterior pituitary is more of glandular tissue. So this is the neural hypothesis. The anterior is the adenohypothesis. And there's a lot more products produced and released in the anterior pituitary. But the hypothalamus is that bridge between the nervous system and the hormone. So from the brain, it has to pass through the hypothalamus to affect pituitary function. All right, let's go with the more difficult one, the anterior lobe. Do not get bogged down with the hormone names. The hormone names will tell you what it does, where it comes from, or where it's going. So if you break down the hormone name, it makes it a lot easier. So the first one's growth hormone. It just goes to tissue for repair and growth. So that one's normal, any part of the body, self-explanatory. Melanocyte stimulating hormone. So where does it go? It goes to the melanocyte. And what does it do? It stimulates melanin production. We have adrenal corticotropic hormone. So the adrenals, they're added to the renal. So this comes from the cortex. So this is the outer surface. So we have the medulla in the middle, cortex on the outer surface. And tropic means it turns it on. So from the pituitary, it's going to go to the adrenal cortex, and it's going to turn on its products. Thyroid stimulating hormone, it's going to go to the thyroid, and it's going to help its producing its hormone, which is thyroid hormone. Continue on with the anterior lobe. We have follicle stimulating hormone. So another name for the egg is follicle. So in the males, it's going to help stimulate production of sperm. Luteinizing hormone. So after the follicle has erupted from the ovary, what's left over is called the corpus luteum. So for the female, it helps further produce estrogen and progesterone. And the counterparts in male hormones in the female body is called progesterone. So here in the male body, they just help produce testosterone in the interstitial cells of the testes. Prolactin. So lactation has to do with milk. So females, milk production. In males, it enhances luteinizing hormone. So that enhances testosterone production in the interstitial cells of the testes. All right, posterior lobe. This one's the easier one. So where are the products produced? So they're produced in the hypothalamus, but they're stored and released in the posterior pituitary. Antidiuretic hormone. Your body's goal is to keep up blood pressure. So in order to keep up blood pressure, we gotta retain water, right? Blood fluid volume. And the second hormone is oxytocin. Has a couple functions in the female uterine contraction. So if they are inducing labor, they'll give you a Pitocin drip. Pitocin is the brand name for oxytocin. And breastfeeding and bonding. For males, during sexual climax, It allows for contraction of the prostate and the vas deferens to propel the semen. Thyroid gland. The thyroid produces two hormones. This image is just showing you where it's located, and the parathyroid hormone. So normally you'll have 4 nodules, and these are within the thyroid, but some people might have fewer, some people might have extra nodules, and that'll dictate parathyroid hormone levels. So the first hormone is going to be thyroid hormone. So it's either T3 or T4. This just tells you how many iodine atoms are in the hormone. So it's either 3 iodines or 4 iodine. So it's the only part of your body that will actually need iodine. And we'll talk about deficiency or malabsorption of iodine in the diseases. So thyroid hormone regulates your metabolism. So adequate amounts, you'll have good metabolism. If you don't have enough, you'll be slow and lethargic. The second hormone it produces is calcitonin, and as the name dictates, it takes calcium and puts it into your bones. So if you have osteoporosis, they may give you calcitonin for your body to take that blood calcium and then send it to the bones. Let the osteoblasts build bones. Parathyroid hormone. Parathyroid hormone, in conjunction with calcitonin, will help regulate blood calcium. It does the exact opposite. Whereas calcitonin lowers blood calcium, parathyroid hormone will increase blood calcium. And calcium in the blood is very important. It's also involved in muscle contraction and blood clotting. So together, calcitonin and parathyroid hormone will regulate your bone and calcium levels. So osteoclast, crush bone. So that will send the calcium to the blood. The adrenals. Supraadrenal. Supra just means above. So here is the kidney, and then right above them you have the adrenal glands. Two main portions, the cortex. So there's about 3 different layers, and that'll produce 3 different hormones. The medulla is easy. It's just one hormone that we'll consider, which is epinephrine, adrenaline, norepinephrine. All right, let's go to the medulla. So it's responsible for your flight or fight response. So that is epinephrine or norepinephrine. So these guys are very similar, and collectively they might be just referred to as adrenaline. Right? So they're going to upregulate. So vision, heart rate increases, breathing increases. There's sugar being dumped into your bloodstream. That way you have that energy to either run away or stay and fight. The adrenal cortex, here we'll just go over 2 of the main functions. So remember, the cortex is the outer surface. So aldosterone. So similar to ADH, antidiuretic hormone, aldosterone also helps us keep blood pressure up by retaining sugar. So anywhere there's salt, you have to have water. So this is indirectly keeping water in the body. And cortisol. So cortisol is your stress hormone. And it kind of does the opposite. You make less protein, less repair. So that means your immune system will also be affected because it's mostly protein antibodies. The pancreas. So its exocrine function are the digestive juices, digestive enzymes that are produced. So these go via a duct and they directly empty into the duodenum of the small intestines. Those secretions are also very basic to neutralize the acid chyme coming from the stomach. We'll cover that more in the gastrointestinal system. Here we want to talk about its endocrine function and its main hormone that it sends to the blood. So here is a cross section of the islets of Langerhans. So these little islands stained, and you have different cells. So for the ducts, you can see how the products here in these glands are going to be collected in the ducts and eventually be excreted to the duodenum. So here's its primary opening, and here's the back door. Also, on the islets, you'll have alpha and beta cells. So alpha cells will produce glucagon. The beta cells produce insulin. So if you have high blood sugar, right, insulin will lower the blood sugar. But if you have low blood sugar, right, glucagon will tell your liver, your muscles, anywhere, hey, I need more sugar in the blood, and it'll increase your blood sugar. So for review, alpha cells, glucagon, they increase blood sugar. Beta cells produce insulin, and that helps you decrease blood sugar. So in the case of diabetes, a lot of people will lack insulin or become insensitive to insulin. So that's going to be type 2 diabetes. If it's type 1, you no longer have beta cells, and you'll need to inject insulin for the rest of your life. The pineal gland. So its main function is to produce melatonin. Don't get this confused with melanin. Melanin is the pigment. Melatonin is the sleep hormone, and it is released during the dark stages. So for us, we all are on our screens at night getting additional blue light, and that lowers the amount of melatonin that's produced. So we're staying up longer because it's disrupting our sleep-wake cycle. So the circadian rhythm is the sleep-wake cycle. The thymus gland produces thymosin. So this is an immune protein. And for children, especially infants, theirs is a lot bigger. And that's because their immune system is insophisticated, very dumb, so they just produce generic soldier cells. They have a strong immune system. Babies have a strong immune system, but it's very unspecified, unspecific. So as we age, our thymus gland actually shrinks as our immune system learns and becomes smarter. The gonads. So for the ovaries, they're actually suspended by a ligament right off the outside of the uterus, producing estrogen and progesterone during the cycle. We'll cover this more in the reproductive system, but at the beginning, days 1 through 28, there will be a high amount of estrogen, and then halfway through the cycle, estrogen kind of dips off, and conversely, progesterone starts off slow or low, and then at the later stages of the cycle, it increases. So that's what they mean by the menstrual cycle or the female cycle. It's the cycling of those two hormones. For males, main hormone is testosterone in the interstitial cells of the testes. There's also hormones produced by other tissues of the body. There just isn't a specific gland for it or a structure that produces them. So your stomach needs to communicate with the rest of the digestive system. And instead of neural signals by nerves next door, like the top of the stomach with the first part of the small intestine, the stomach will actually produce hormones to communicate with other parts of the digestive system. So those hormones will enter the bloodstream, signaling digestion, how far along digestion, and the digestive system will adjust accordingly. Small intestines produce some of its hormones as well, and that's to communicate with other parts of the GI system, including the stomach. Your heart makes its own hormones to regulate blood pressure. And the kidneys, one very important one. If you have kidney failure, you'll also have anemia, because erythropoietin is the hormone from the kidneys that stimulate red blood cell production. So if you have kidney problems, most likely you'll have red blood cell problems as well. Stressor. Anything that produces a response is a stressor. So it could be something positive, could be something negative in your life, but it's just called a stressor with an OR. So we mentioned the stress hormone, cortisol. So that comes from the adrenal cortex. So cortisol has profound effects. It decreases protein. It decreases inflammation. So that means it decreases your immune system, because inflammation is part of the immune response. So that means I'm not making protein, I'm going to be making fat. So stress might be the thing that's making you fat, even if you're getting enough exercise or you have a good diet. General stress syndrome. So some people have just general anxiety, general stress. Can be relieved with daily medication like Valium or Xanax. And some patients will take it PRN as needed. So if they feel an attack coming, they kind of know the syndrome, the start of the syndrome. So they'll take a Xanax, a Valium, and hopefully that aborts them from a panic attack. Increased heart rate, respiratory. Just think about anytime you felt a little stressed out, maybe public speaking for some of you guys, and then that's the danger hormone, cortisol. All right, now let's go to some of the diseases and conditions. I'll just skim them quickly. You can review them further in the book. So acromegaly. Agro means extremities. So in adults, if you have too much growth hormone, the extremities will grow. So your chin, your fingers, your head, and your feet will continue to grow. Addison's disease. The puffiness of Addison's disease, or the puffiness in JFK's face, is due to failure to produce enough corticosteroids. So it's going to affect how your body metabolizes, in this case, the glucocorticoids. Cushing's disease. Here you have hypercortisol. So remember, you're going to get a lot of fat redistributing to the face, to the hump, the back of the neck. Diabetes. Diabetes means to flow like a fountain. So it doesn't mean necessarily the sugar problem. It just means you gotta pee a lot. And one of the symptoms of diabetes with sugar is you have to urinate a lot. But this one is not sugar. This has to do with ADH, antidiuretic hormone. You don't have enough of it, so you're not holding on to water, so that causes you to, well, insipidus means tasteless. So this urine that flows like a fountain will be tasteless. Whereas if it's diabetes mellitus, which is the sugar problem, then that urine should taste sweet if you have diabetes. And this was one way doctors used to diagnose diabetes. They'd taste the urine to see if it was sweet or not. Diabetes, type 1, aka juvenile onset. So usually what happens is the beta cells will get killed off or die off following a disease, something that maybe caused the immune system to attack its own body. In type 2, either you're not producing enough insulin because you stress them out by forcing your pancreas to make too much all the time, so now your pancreas doesn't make enough, or your body becomes insensitive to insulin. So even though there is adequate insulin, your body has no idea what it is. And lastly, during pregnancy, many women can develop gestational diabetes. Usually goes away after birth of the child. Get it checked. Runaway diabetes during pregnancy can lead to a very, very large baby. So in the 3rd trimester, you just want to check the baby size, make sure there's no complications. Dwarfism, not enough growth hormone from childhood. Gigantism, now this is growth hormone during childhood and beyond. Right? So acromegaly is adulthood. So these people will grow proportionally pretty much, but acromegaly, you'll have longer fingers, longer jaws. Goiter, or enlargement of the thyroid gland. Well, the thyroid gland can enlarge multiple ways. Here, deficient in iodine. So the thyroid gland is compensating by growing bigger, right? So if I'm not doing my job, maybe I need to get bigger. But all it is all you need is iodine or be able to absorb it. But your thyroid gland thinks it's not, so it compensates. Graves' disease is also a thyroid problem. In this case, it's the opposite. You're producing too much thyroid hormone. So we can give you iodine to kill off the thyroid. Notice the eyes bugging out. So that's caused by fat accumulating in the back of the eyes, pushing the eyes outwards. Cretinism, that's no thyroid from birth, so it's congenital, or it needed to be removed shortly after birth. So severe birth defects. And then in adulthood, if you remove it yourself, then it will pretty much mimic cretinism. Good thing is we can supplement you with thyroid hormone for the rest of your life. All right, that ends the discussion on the endocrine system. So hopefully, Ashley, I got it to you in time for your exam. Well, thank you, everybody, and have a great day.